We were at a point within CHI Franciscan where we were down to approximately 3 days of PPE on hand. And so the catalyst behind coming up with the cloth mask was to answer the question, what are we going to do if we were to run out of masks completely? So I wanted to reach out to our director of disaster preparedness. And then I also wanted to reach out to our infection prevention director to make sure that if we were to sew masks, that it would be okay from a system perspective, and that they would support the research that we had looked at to make sure that these masks would be safe in certain situations for our team. Somewhere between that conversation with them and the chief medical officer, it became sewing all of these masks for the entire system and not just St. Anthony Hospital as a whole. So it went from being 2,100 masks to 35,000 masks across our system. So basically, when you see the mask, you will see that the cool things about it. One is they picked out their designs. And then on top of it, in the very top, you'll see that there is a little piece of wire that's in the top of the mask that kind of holds it to our nose. And then on the sides of it, it has the elastic for the ears. And so when I put it on, you can see that I have it right here so that the wire holds it down. And then the elastic goes behind my ear on the one side, and then it goes behind the ear on the other side. And you can see here that design goes up. And so the Dr. Nolan wanted to make sure that it absolutely covered your face. And then she wanted to make sure there's lots of coverage on both sides and then also on the chin. So that really was our purpose, to allow us to keep our PPE that we consider hospital issued for the situations in which our policy says we have to use them, and then to use the cloth mask in the other situations. And what we've seen is that we've seen an increase in the number of days that we have on hand, and we've seen a little bit of relief in our team members in the fact that they can have and wear a mask on a day-to-day basis, an hour-to-hour basis, and interact with each other and still be safe. Some of these masks, I will say, are sewn by our team, but most of these masks are sewn by members of our community in which we do not know their names, we don't have their faces, and they gave of their time, their love, their compassion, and so all these masks for our teams. So what we mostly feel is grateful, we feel blessed, and we feel very, very appreciative of our community coming together to help us.